So let's talk a few minutes about the Spectrum Health Multidisciplinary Clinic, specifically for Parkinson's disease. Dr. Coleman, what's unique about this clinic?
Well, I think there are many things that make our multidisciplinary clinic unique. I think the first is our team-based approach. I think our second is the way that that team-based approach is applied in a streamlined, coordinated visit in one location that's convenient for the patient. In order to be a part of this multidisciplinary clinic, you have to be an established Parkinson's patient with a movement neurologist at Spectrum. But once you are part of the clinic, what you'll experience is a single 4-hour visit where we have multiple specialists who all focus on Parkinson's within their field coming into your room to do their evaluation. And the people that you might see, you can see depicted up here on the screen, would be a movement disorder neurologist or Parkinson's expert like myself, Dr. Sriram, or one of our colleagues, Dr. Chris Cobbett or Emily Ruther. But they will also see a pharmacist, a social worker, a physical therapist, an occupational therapist, and a speech therapist. And at the end, we generate a comprehensive treatment plan that incorporates the evaluation of all of these different specialists and is also individualized for that specific patient. Let me take a step back for a moment and talk about why this team approach to the treatment of Parkinson's is so important. I think the biggest reason is that Parkinson's is complex, as I'm sure you're beginning to gather. And in order to adequately address all of these different aspects of Parkinson's, it's very difficult to do in a single 30 to 60-minute visit with one individual. We really need a team. And I've heard people talk about this in relationship to sports. And since we have Kirk, maybe we'll do baseball. If you think of your neurologist as a pitcher, you don't want a team full of pitchers. You need other individuals who are good at their job and good at what they do to contribute to the team in order to make it successful. So let's talk a little bit about the treatments that are available for Parkinson's. So there are conservative treatments such as exercise, physical therapy, occupational therapy, speech therapy. We'll talk a little bit more in detail about those later. We also have medications. They're not always necessary, but when they are, we use them to target symptoms that are bothering the patient, whether those be the motor symptoms that I discussed or the non-motor symptoms that Dr. Sriram discussed. And we also have, for some patients, surgical options available for the treatment of Parkinson's, including a unique treatment that we offer here at Spectrum Health called deep brain stimulation. This is an area of expertise for both myself and Dr. Sriram. Ashok, would you mind explaining it briefly?
Absolutely. Well, DBS, it stands for deep brain stimulation. It's a powerful treatment option for patients with advanced Parkinson's disease. If you or you're one of those people whose symptoms are not well managed just with the medication alone or combination with medications and an exercise program, probably you're a good candidate for one of these procedures. What does it involve is that it involves a surgical implantation of a wire, we call it as electrodes, that goes deep into the part of the brain that controls movements, sort of like a pacemaker for the brain. And these electrodes or the wires, they are connected to a battery pack to the wires that goes just under the skin. Once the procedure is done, nothing is visible from outside. And what the battery does is it delivers high-frequency electrical signals to these key areas where the movements do happen, at least the abnormal movements, and help with these symptoms of Parkinson's disease. All the cardinal symptoms of Parkinson's, the motor symptoms, what Dr. Coleman mentioned about, can be helped by just DBS. There are two ways of actually doing this procedure. One way is actually, we call it as an awake procedure. What that means is that the person or the patient will be awake for the key part of the surgery. And what we do is we take a probe and we actually navigate through the brain, sort of listening to the cells, cross-talking with each other, and sort of identify the structures in the brain based on how they cross-talk with each other. And we just go ahead and put it and make sure that, we examine them while they're awake and make sure that they got the symptoms controlled. The second way of doing it is that people are actually asleep during this procedure. We take that patient actually to an MRI suite, and we actually do a real-time MRI-guided procedure. We call it as a sleep DBS process. How we are unique here in West Michigan is that we are the only center here who can actually offer both types of procedure here. It's a powerful treatment.